The lawmakers will soon begin debate over a bill that would create a public option in our state's health insurance exchange. The goal, they say, to lower premiums, not just on the exchange, but for all health insurance customers in general. Our Andy Cohen live with a closer look at who the legislation would help and exactly how it works. Andy.
Yeah, Rob, lawmakers want to help people who buy their health insurance on the state exchanges, especially those in rural communities where a lot of times, there's only one provider who's offering plans, and those tend to be the most expensive plans on the market.
Our resolve to make health care more affordable for Coloradans.
At a virtual press conference Thursday, Democratic state lawmakers announced plans for a new public option health insurance program. Several counties in Colorado have just one provider that residents can choose from on the state exchange.
For me, the two counties that I represent, Eagle and Routt, there is only one option on the health insurance market for those who buy on the individual market. And those premiums are some of the highest, not only in our state, but in our country.
Guests at the news conference shared their frustration with the high costs of premiums. Stephanie Salazar Rodriguez said she pays about $12,000 a year.
I didn't expect to find myself in this situation. Nobody does. And the options that I have are simply not affordable.
I would really like to see this not only help me, but also help my colleagues who are also struggling with affording our medical expenses.
The Colorado option would create a state-structured insurance plan offered through a new nonprofit called the Colorado Option Authority. Hospitals and healthcare providers would be required to accept the plan, and the state insurance commissioner would set the reimbursement rates.
This isn't about imposing government mandates on the industry or forcing anyone to give up health care that they already have and like.
These plans would target those who buy their insurance either on the individual or small group markets, or roughly 15% of policyholders in our state. The rest receive insurance through employer-provided plans.
Now, a similar bill was introduced at about this same time last year, but that's right when the pandemic hit, so it had to be shelved. And the sponsors of the bill say that they've since heard from the health insurance industry, who said that they believe they can bring down premium costs on their own. So the way this bill is written, it gives a 2.5-year period, or till the end of 2024, for them to meet that 20% reduction target before the public option kicks in. Always watching out for you, Southern Colorado. Andy Cohen, News 5.